At the time that I was training in oncology, there was a lot of new, exciting developments. So it went from a very incurable field to a much more curable field. And that was exciting. That was exciting, especially to a young medical student or a young training physician. So I think that's what initially got me started. But then once I started actually, rounding on the floors and experiencing the patients, which in those days was a lot of inpatient oncology, not so much outpatient like we do nowadays. It was amazing that you got to meet the people and the families, and that they were really your patients for the rest of their lives, as were their family members. So it was a true honor to not just treat an illness, but to treat them. We spend more hours here than we do at home with our spouses and our children. So we're a family, and the patients feel that. And I think that that's really important. 26 years ago, there was an explosion of different types of drugs. And so we saw people change. We saw people go from very ill to chronic illnesses. And I think that that's what we're going to be seeing now. We didn't have the technology 26 years ago to do that, even though we were doing immunotherapy. We were just doing it differently. We were using vaccines and things like that. So now we have a whole new class of drugs, and we have more targets to be able to develop these drugs towards. The first time somebody comes in with an illness that a month before I didn't have a good option for, and all of a sudden the FDA's now approved it for a previously incurable disease. I don't know that I'm going to be able to cure this patient, but my options now are just huge compared to nothing. It's being able to offer them something, to be able to offer them hope and guidance. And like I said, it's truly an honor to be able to treat these people and their family for the rest of their lives, for the rest of my life.